get started. Thanks for showing up again. You guys, I know you're probably like, what the hell is this guy talking about yesterday, but I want some more. I was kind of the same way, and you'll find that the more you hear this stuff, the more it's going to start sticking in, and just being exposed to it is going to help you in the long run with classes and with your practice ultimately. So it's awesome you guys are showing up. Today we're going to just go a little bit over the frontal lobe. I'm kind of catering this to the guys who've been here a little bit, but just try and follow along as much as you can and see if you can get something out of it. Okay, so frontal lobe. Frontal lobe, the newest part of our brain. It's what makes us human. It takes up over 1/3 of the whole entire brain. It's one lobe, but it's kind of split up into a lot of different components. So I'm just going to start from the back of the frontal lobe and then move forward. First of all, we're going to start with the motor strip, which is the furthest back in the frontal lobe. That's the primary motor strip. That's where...
Can you draw?
You have
I'll go find you one.
That's where all of your movements start from. So your all your corticospinal tracts. They start in the pyramidal cells of Betz and layer, I believe it's 5 in the cortex, and then go down decussate in the lateral corticospinal tract and control the extremities on the opposite side. Anterior corticospinal tract, 90% goes down, crosses over, and then 10% stays ipsilaterally just to control your truncal muscles and stuff like that. Big thing you want to remember about the motor strip is the homuncular representation. What a homunculus is, for you guys that have never heard of that before, it's just a somatotopic map, which is just a map of your entire body on that lobe. So your left primary cortex, motor cortex, has a map of your right side of your body. And then it's opposite on the other side. One thing to note about the right cortex, though, is that there actually is a map of both sides of the body, which makes things a little bit more confusing. But just keep that in the back of your mind. For you starters, don't even worry about it right now. We'll come back to it later. But for you guys, just if you're looking at say left brain lesions or right brain lesions, just know that there's that bilateral representation, and if things aren't matching up correctly, just maybe dive in a little further and remember that there's that extra map on the right side of the whole entire body. That could be something going on with that. Okay, so homuncular representation, the best way I remember this is your legs. Okay, so you start in the middle, your legs are here, and the way I remember it's kind of weird, I have 2 people standing back to back, and then I have them put the diving position and then bending over. And if you can just remember that, that's how the homuncular representation goes in the brain. So the legs are here, and then it's the trunk, and then it's the arms, and then the face. So it's just an easier way to remember it. That's really all I wanted to say about the primary motor cortex. Then we go a little bit more anterior in the brain, and we get to the premotor and supplementary motor cortices. These are more dealing with the pre-planning of your motor activities. Especially the premotor cortex is super important because let's say we're going to go to move our right arm. So what actually needs to happen before you go ahead and move that right arm is you need to have all the shunt stabilizer muscles come online before you flex that bicep, or your radial head's going to come up and smack you in the face, and that's just not a good thing. You want. So if you have a problem with your premotor cortex, you're going to be more prone to injuries on that side. That's basically what's going on with that. And supplementary motor cortices, those deal more with your pre-planning, but they don't actually project down to the spinal cord like the premotor cortex does. This has to do more with pre-planning complicated movements and things like that. Let's see. Oh yeah, testing for that is just, I do the finger tapping, and that has to do with a lot of other stuff too, but the more complicated your movements get when you're testing fingers, the more anterior in the brain you're going to go. So that's pretty much all I got for that. Broca's area, areas 44 and 45, that has to do with production of speech. That's primarily a left brain thing in most people. Let's see, and you do have a Broca's area and a Wernicke's area in your right lobe as well. And when you have lesions in that one, you're not going to lose speech, but you're going to lose the emotional tone of speech. Like when I was talking about yesterday, the right brain has to do more with emotional stuff and big picture and all that kind of stuff. When you lose function of your Broca's area in your right cortex, you're going to deal with a thing called aprosodia a lot of times, and that's just losing emotional tone to your speech. So say someone has a stroke and then it affects that area. They're going to be able to talk, and they're going to be able to understand everything, but they're not going to be able to put any emotional intonation on their words. They're going to sound kind of like a robot. So instead of being like, yes, I had a great day today, I had a great day today, something like that. Let's see. Oh, testing for Broca's area. There's a good test. You go to your patient, you ask them to name as many words as they can in 1 minute using whatever consonant you have. I use either F, A, S, or G. Usually that's what I've heard of. And you tell them that they can't use proper nouns, so it can't be like Georgia or something like that. And it can't be different kinds of words related to a similar word. So it can't be like great, greatest, anything like that. So then you're like, okay, I want you to say as many words as you can with G for that minute. And they should be able, a normal person with a good education should be able to do at least 9 words. Somebody with less of an education should be able to do at least 6 words. People with lesions in the Broca's area, usually you'll see them do 1 or 2 words and then they'll be silent for the rest of that minute. Or they'll keep perseverating on the same word, or they won't follow directions or something like that, and they'll say proper nouns, things like that. Let's see what else. So then you get into your prefrontal area, which is super complicated, and that's really what makes us human. That's where your personality comes from. That's where your executive decisions come from. That's where your emotional regulation, your suppression of urges, all that kind of stuff comes from. So that's kind of made up into three to four different areas. You've got your dorsolateral prefrontal cortex. You got your orbitofrontal cortex, the medial and the lateral portion of that. Anterior cingulate gyrus is part of it as well. So, when you're looking at ADD and stuff like that, your dorsolateral prefrontal cortex is usually the area you're going to be focusing on. That has a lot to do with attention and also tracking when you're looking at the eyes. If they can't visualize on something, could be the dorsolateral prefrontal cortex issue, along with, you guys know, a lot of other things.
Is that sighted, right or left, or could be either?
It could be either, and then you would want to base it off your history and then personality and right versus left brain kind of stuff.
Sure.
So, what was that? ADD, ADHD. Yeah, a lot of kids with ADD, ADHD, dorsolateral prefrontal cortex. One cool therapy note on that is there's lots of representation from the trunk and legs in that. in that area. That also has to do, when I was talking about hemistem yesterday, that has to do more with high frequency stuff. So you can incorporate that into the hemistem as well later. I'm going to do a whole sheet on that to give you guys next week, so you can start messing around with that. But if you're doing hemistem, say, and you figure out that your patient has a right parietal lesion, but he also has kind of a dorsolateral prefrontal cortex lesion on the same side. You can have them looking at hemistem, sitting there, and then you can have them maybe doing some leg movements, or you can have them a tuning fork on the spinous, just because that input from the legs and the spine play more into the dorsolateral prefrontal cortex than other areas of the body. It's just more presynaptic drive into those neurons and creating more plasticity in that system. Let's see, a lot of your limbic escapes has to do with your medial orbitofrontal area. Limbic escape meaning what I was talking about yesterday, with your right side having to do more with your negative emotions and your left side doing with positive emotions. So a lot of times you'll see people with problems with the medial orbitofrontal cortex acting out and just becoming super irritable and then not being able to suppress that. So say somebody comes up to you and just gets in your face like this real quick. Maybe they're mad at you and they come this close, and that's a super limbic stimulation right there. Normally, any of us would be like, okay, why is this guy in my face? And I want to get him out of my face, and I just don't know what the hell's going on right now. So somebody with a limbic escape would just go ahead and knock the guy on the ground and not even think about it twice. And that's what your prefrontal cortex is more in charge of attenuating these kind of issues and responses and stuff like that. I know I'm missing tons of stuff, but there's so much information. You guys have anything else to add? I can't think, there's too much information to go over in like 30 minutes. So.
Can we do just some basic frontal lobe tests?
Oh yes, yeah, I didn't even do frontal eye fields. So your frontal eye fields also are in the frontal lobes, just another note. That starts volitional movement of the eyes to the opposite side. It also has to do with generating saccades. For you guys that don't know what those are, that's when you're looking here, you're looking in your general visual field, and something moves over here, and your eyes just automatically jump there. That's a saccade. When you're pursuing something, that's when you have your eyes on an object, and you're following that object in relation to the background. Saccades are super complicated, but they're a great way of assessing frontal lobe.
So what's the direction? Like a rightward saccade would be a leftward frontal lobe, right?
Yeah.
Right.
So I was thinking we just pair up for 10 minutes and just start doing some of these tests.
Yeah.
So what test do you want us to do?